Hello everyone. Welcome to the Ophthalmology Wizard. I'm Dr. Mahboob, MD Ophthalmology from Aiims, New Delhi. And today we are going to discuss very important topic, that is Sparks 3-step test, which is very important for the NEET PG, NICT and FMG examination. Okay, and I'm going to discuss the quick trick to solve MCQ related to the Sparks 3-step test. So the Sparks 3-step test is the 3-step test where we rule out stepwise manner the vertical muscles. Okay, so we will be discussing this Sparks 3-step test with the help of the MCQ. The MCQ is saying that a patient with the right hypertrophy in primary gaze, right hypertrophy increases in the right gaze and on left head tilt. Which of the following extraocular muscles weakness is there? So to solve this problem, we have to apply Sparks 3-step test. What is Sparks 3-step test? It is done to rule out the one single weakest extraocular muscle. Okay. Now, to solve this Sparks 3-step test, so we have to remember one schematic diagram. This is the one schematic diagram that is very important, that you have to denote the 4 and this 4, total 8 vertical extraocular muscles on the paper, right? This, look at this oblique muscles. This oblique muscles are towards the nose side and this rectus muscles are towards the lateral side. Why? The oblique muscles are towards the nose side and the rectus muscles are towards the lateral side. Why I have written this? The simple answer is that in the abducted position, the rectus are primary elevator and depressor, and in the adducted position, the oblique muscles are primary elevator and depressor. That's why this is the schematic diagram like this. Okay. Now the first step we will do to rule out. First step we will do to rule out the 4 muscles among these 8 muscles. Okay. For this we have to see. For this we have to see in primary gaze which eye is hypertrophic. So right eye is hypertrophic in the primary gaze. So in the primary gaze, right eye is hypertrophic. Right eye is up. That means the left eye is down. Since right eye is hypertrophy, right eye is up, that means the right-sided depressor muscles are weak. So we will mark the depressor muscles of the right side. And since also we can say the left-sided hypotrophia, that means the left-sided elevator muscles are weak. So we will mark this one. So these muscles are ruled out and we are left with these 4 muscles. Got it? Got my point? Coming to the second step. Second step is done to rule out the 2 extraocular muscles among the 4 extraocular muscles. Now, at this point, you just remember one thing, that is nothing but VOOG. What is VOOG? Worst on opposite gaze. Hypertropia worst on opposite gaze in superior oblique palsy. If there is a superior oblique palsy, that means the hypertropia will be worse on opposite gaze. Worse on opposite gaze means superior oblique palsy, right? This you have to remember. Okay, now since here hypertropia increases in the right gaze. Right gaze means on the same gaze, because right hypertropia increases on the right gaze. Right gaze means same side, means this is worse on the same gaze. This is worse on the same gaze. So since VOOG is worse on opposite gaze, so this is not the superior oblique weakness, right? So we will rule out the superior oblique here. We will rule out the superior oblique here. Since we are ruling out the superior oblique muscle of this eye, then we also rule out the superior muscles of the other eye, because the superior goes hand in hand inferior inferior goes hand in hand. ओके अगर यहां सुपीरियर मैं कट करूंगा तो यहां पे भी सुपीरियर मैं कट करूंगा. नाउ we are left with two muscles, this one and this one, inferior rectus of right eye, inferior oblique of left eye. Okay, you got my point? Coming to the third step, this is the third step. Before going into the third step, you need to remember the 2-3 points, that is superior are intorter and inferior are extorter. Superior are intorter and inferior are extorter. Okay, one more thing, intorsion means coming towards the nose. If eye is moving towards the nose, this is intorsion. If eye is moving away from the nose, this is extorsion, right? Now when I do the right head tilt, then the eye should move towards the nose, right eye should move towards the nose, and left eye should move away from the nose. That means on the right head tilt, right eye should intort, left eye should extort. Okay, similarly on the left head tilt, left eye should intort and right eye should extort. Just remember one thing, if I do right head tilt, right eye should intort. If I do left head tilt, left eye should intort and opposite eye should extort, right? So rule of thumb, on right tilt, right intort, on left tilt, left intort. Right, that's it. Now how to rule out the one single muscle? That is, I am left with this two muscles, right? This is left eye, this is right eye, and we are left with right eye ka inferior rectus and left eye ka inferior oblique. Then among these two, one has to be the answer, right? So after the two step, either you will be left with inferior muscles or you will be left with superior muscles. Okay, since inferior are extorter, then you have to only see that on head tilt which eye should extort. Okay, since in this question right hypertropia increases on left head tilt, so on left head tilt, left eye is intorting, right eye is extorting. Means which eye is extorting? Right eye is extorting. So inferior are extorted. So answer will be this. So this will be the answer. This is ruled out. Okay. Now this is the answer. Suppose this is the, after two step you are left with right eye, left eye, inferior oblique and inferior rectus, and the question is saying that right hypertropia increases on right head tilt. Since you are left with only inferior muscles, so you have to see what? You have to see which eye should extort. Why? Because inferior are extorted. So on right head tilt, right intort, left extort, right tilt, right intort, left extort. Okay, that means inferior of left eye should be the answer. Okay, one more example. Suppose this after two step of Park's 3-step test, after two steps you are left with superior oblique and superior rectus. After two-step test you are left with superior rectus or superior oblique, and it is saying that the hypertropia increases on left head tilt. Hypertropia increases on left head tilt. Okay, since we are left with superior are intorted, that means we have to find out which eye should intort on head tilt. In left head tilt, left intort, right extort, right, left intort and right extort. So which eye is intorting? left eye is intorting. So we have to answer the left eye superior. So this will be the answer. You got my point. Anything, any difficulty, DM me, message me, write a comment. I will try to answer all these confusing points. And if you want to more explanation on intorsion and extortion, please feel free to ask. Thank you. Thank you.